Hi, I'm Madison, and this is gastric dilatation and volvulus. So what is gastric dilatation and volvulus? It is an acute, life-threatening pathological condition in dogs and is usually in large and giant breeds where the stomach fills with gas or fluids, then it twists, that's the volvulus, cutting off the blood supply. It also affects the visceral organs, which is specifically the stomach in this case, and this condition is also known as bloat or simple bloat. Here is an image of what GDV does in a canine, and you can see how in a normal dog on the left, their stomach is of normal size, and on the right, it is severely bloated. So the organs of interest, again, it primarily involves the stomach, and it's filled with gas or fluid, and it's in the left cranial abdomen. The spleen, which is, it can be displaced or twisted during this condition, and it's on the left side of the abdomen along the lateral body wall. The esophagus, which can be compressed or kinked, and it's hard to vomit and relieve gas buildup. The diaphragm, it impairs respiratory function. The cardiovascular system, the liver and the pancreas, and that's in the cranial abdomen and caudal to the diaphragm, and the small intestine, which is central and caudal to the abdomen. And here is a photo of a dog that you can sort of see the different parts and in relation to the condition. And is it acute or chronic? GDV is acute. The stomach can inflate and twist within minutes to a few hours, and it rapidly obstructs the blood flow and compressing the diaphragm and sending the dog into circulatory shock. Without prompt decompression or surgery, death is likely within 6 to 12 hours of onset. This condition is acute because it happens very quickly when the symptoms start happening, and it usually requires immediate stabilization and surgery. So here are the clinical signs and symptoms: hypersalivation, restlessness, non-productive retching, which is the sound of movement of vomiting, but they're unable to actually vomit, dysphagia, enlarged or swollen abdomen, pacing, distress, panting or rapid breathing, peritonitis, which is possible if perforation occurs in the spleen with the twisting. And here are, it's a photo of the stages of GDV, and more so kind of like a symptom where you can see how the left is healthy and it just slowly starts to get worse with the enlargement of their abdomen. And here are the diagnostic tests. They will do parenteral fluid therapy, and they'll do administration of analgesics and anti-inflammatory drugs. Surgery is required to untwist the stomach and to remove tissue damage. They'll do a gastropexy, where the stomach is sutured to the abdominal wall to keep stomach in place and to prevent the twisting if bloating happens again. And they'll do x-rays to confirm that gas is in the stomach, and the stomach will look compartmentalized, or they call it a double bubble. And you can see where the twisted stomach will create two gas-filled compartments with a visible division. So here you can kind of see there's a white line, a white space separating the stomach into the two compartments. And then the treatment and prevention. So it will definitely need surgical correction, and it's needed to untwist the stomach and return the stomach to the appropriate position. And they'll also remove damaged tissue, and that allows for the ability to assess the amount of damage caused by the lack of blood flow due to the twisted stomach. And again, the gastropexy, used to keep the stomach in place, prevents twisting with future bloating, and it actually has a success rate of 95% if GDV reoccurs. And again, anti-inflammatory drugs and analgesics, and they are administered via IV, IM, or SQ. For prevention, feed smaller meals more frequently, don't use a raised food bowl, don't let your dog drink large amounts of water at one time, avoid strenuous exercise on a full stomach, and know if your pet's breed is predisposed to GDV. So here are the predisposed breeds. It was a list actually, and most of them are the giant or large breeds, but at the bottom there are some small and medium-sized dogs that are already predisposed. And for discussion, this condition is important to discuss because it is a condition that can quickly make a dog go into shock with every minute. Without treatment or surgery can result in an increased risk of further damage and potentially death. And here are my references.